You know, doctors and network cannot work without the necessary tools. You see, and they have to complain because you see, the public see the doctors, see the nurses, and say, you are not attending to us. But they're in a dilemma. With what are you going to attend to the patient when all these things are not available? Registration tools such as suction machine, ambu bags, face masks, oxygen, emergency drugs are grossly inadequate in the accident and emergency department. Because it's not just only in the other hospital, you know, there are also critical emergency. Demands on patients to buy this material lead to wasting of precious times in emergency with adverse medical consequences. Because there is no functional spirometer that is used to diagnose people with respiratory diseases. No functional ambulance is owned by LUTH. You see, that's why you have ambulance with siren disturbing everybody in the society. There is none in LUTH. Hence, poor patients with critical emergency await death instead of hope of recovery. There is understaffing and lack of ventilators. Nigerians should know that when critically ill patients are not attended to within 10 to 12 hours, such patients may die. What is the relevance of LUTH as a public institution if it lacks in facilities to attend to patients? Close monitoring of critically ill patients is no longer possible because there are no facilities for close monitoring of patients. Under Professor Chris Bode administration, the laboratories are shut at night. Hence, doctors can do nothing and are helpless. To save the lives of patients, rush to LUTH at night. Even the laboratory at the Accident and Emergency Department, built with public funds, is being fraudulently operated as a PPP project to raise funds into private pockets. And it's even more expensive, unaffordable to the poor patient, and does not offer 24 hours service. Electricity and water supply have been deteriorating for months. The erratic supply of electricity and water affects schedules of surgical operations, endanger the security of the hospital environment and safety of patients. The water scarcity is easily noticeable with the messy toilet that stink in the LUTH environment. Most of the hospital buildings are in total darkness, yet patients are there. LUTH at night is like the bush where hunters hunt because nurses put on torchlight on their heads due to darkness in the ward. Elevators are not working. When there is no light, why will elevators even work? The Accident and Emergency Department in LUTH is supposed to be free, statutorily. However, the insensitive management of LUTH imposes an exorbitant fee of 50,000 deposit, thereby condemning to death ab initio patients from the rank of the poor that cannot afford to pay such fees under emergency. Yet all Nigerians have the right to live. There is no emergency in any teaching hospital and general hospitals. Statutorily, they're supposed to charge fee. You see? But what has happened in the LUTH situation is that, you know, because there are two accident and emergency, this thing, and both are, there is one built freely by the Sky Bank as one of their conditions of operation in the place. So that's the one they now try to now call public partnership arrangement. So that's why when you get to LUTH now, they will tell you if you have money you can pay, you can be somewhere. You see? So yet these are both public facilities that are supposed to be available. So imagine now workers that are being owed arrears of salary. You are rushed to the hospital, even for the smallest element. And the first thing is that produce 50,000 before you can be treated. It's not a private hospital. Doctors, nurses, and other health workers are ever ready to work because that's what Nigerians must understand. Because part of the essence of this campaign is for Nigerians to know that the problem you have in LUTH and some of the hospitals are not the problems of those who are working there. Because you cannot work without the truth. And they are ready to save life and to deliver good health care. But what can they do when the medical facilities and consumables are lacking? Or what can they do with few facilities available when Professor Bode shut the laboratories at night, like he's running his private clinic for cash in hand patients? Where go the funds allocation to LUTH, yet no medical facilities and consumables? The answer is simply Professor Chris Bode's obsession for looting and greed. As a matter of fact, when you have a chief medical officer whose priority is to buy jeeps, when some of these machines that are here are as low as 950,000 naira, you see, then you can have a jeep of 36 million. So you can see what exactly is happening in that situation. So some of the above problems are due to the wicked and anti-human authority of the chief medical director. Doctors, nurses, and other health workers who have spoken against the threatening state of public facilities and management of patients in LUTH are being illegally and unjustly victimized. There are currently 2 cases, Dr. Olorunfemi and Dr. Adeyemi. Dr. Olorunfemi was unjustly sacked over an issue for which Professor Bode ought to have been sacked. Because can a doctor conduct surgical operations on 2 patients at the same time? 2 patients were brought under critical conditions. You see? So, and for the doctors, who do you attend to? And from their ethic, you see, attend to the one you feel is more critical. But ideally, if those facilities are available, and if that place was not understaffed, you get it. It will not only be Dr. Olorunfemi doing that. As Dr. Olorunfemi was finishing that operation, he was even already asking them to prepare the other person. So you see the hours that were lost. So the other person died. So you now have to victimize. You get it? Because there is no way that kind of doctor can operate 2 people at the same time. So that's the kind of condition. And the same case with Dr. Adeyemi, you see, who against all known medical ethics, you see, because he also has a vocal voice that you can't continue with these situations. We cannot work without you. You see, these are public institutions. You get it? Even if funds are inadequate, even the funds that are there can still be used to procure basic equipment. And since he's working to qualify as a resident doctor, because they have to take exam as a consultant, you see, at that level and go. You see, against no medical ethics, they issue him query, they ensure that he will not write his exam. Even when there is the medical ethics that even if you are caught cheating in writing the exam, you should be allowed to write that exam. And a panel will be set up to handle such cases. We are talking of countries where we are even short of doctors. You see, those who want to work patriotically, you are also eliminating them. So let's join hands to save LUTH and save human life. So this is our demands to Nigerians, medias and others, for us to reverse this trend. 1, the federal government has a responsibility to make LUTH and other public health care centers across the country to work with adequate funding and medical supplies. Immediate and unconditional restatement of Dr. Olorunfemi, Dr. Adeyemi and other victimized health workers in LUTH, and payment of just compensation to all the victims of LUTH management high-handedness. We are also struggling to defeat all the wicked policies and measures in LUTH, whether by Professor Bode or even any others, you see, that are targeted at the poor Nigerians, the patients, the workers, and their union. Nigerian nationwide must insist on their right to public health care and demand that LUTH, other teaching hospitals, and public health facilities must not be neglected at the expense of looting our national wealth to offset the foreign medical bills of the rulers in government, local, state, and federal, and other cronies of government who seek for medical treatment abroad. Immediate and unconditional cancellation of the mandatory 50,000 deposit imposed on patients at the emergency health care unit. Total reversal of the policy of commercialization of health care and public health facilities. You see, for JAV, we have made this point clearly in education, in health, and others. If people want private hospitals, they can build their own. But you don't commercialize public facilities because it's meant for everybody. Because that's the only asset that levels most Nigerian public institutions. So the questions of not having access to health is now conditioned by having to pay money. So if you don't have money, you don't have health care. That is what it has turned into.